Hi, I'm Walt Sherman. A few months ago, I had coronary bypass surgery. You wouldn't know it to look at me today, except for the scar on my chest and leg, which are daily reminders for me to keep up my exercise and to eat right. I was in an exercise program, feeling good, when I went to my doctor for my yearly checkup.
Doc, how'd I do?
Here at the beginning of the test, Walt, it looks good.
Is it normal?
Yes, this is normal. Now, towards the end of the test, when your heart was under a great deal of stress and you were walking uphill very fast, the EKG changed. This could mean that you have some heart trouble, but we will not know for sure until we do an additional test.
What kind of test?
The test is called a coronary catheterization test, and this requires admission to the hospital. It requires the use of special X-ray equipment, enabling us to actually see your coronary vessels and to see how your heart functions.
Dr. Freeman scheduled me to come in for my heart cath the following week. I don't mind telling you, I was scared what they might find.
Good evening, Walt. Hello, Mrs. Sherman.
Hi, Dr. Freeman.
Well, Walt, you look comfortable.
I am. I feel fine. The nurses have really been taking good care of me, but I'm kind of apprehensive about it all.
That's to be expected. Most patients are. Nobody likes to be in the hospital. But you must remember that it's important for you to be here for this heart catheterization, which will be done tomorrow and which will show us how well your heart works.
It would help a lot if I knew what was going on.
Well, let me tell you about the heart catheterization, or heart cath, as we call it. But first, let me tell you about your heart. Your heart is about as big as a fist. Now, it is a pump, a very efficient pump, that circulates the blood through the blood vessels to all tissues of the body to supply fuel and energy. In 24 hours, the heart pumps about 4,000 gallons of blood. If it was pumping gasoline, that would be enough gasoline for you to drive across the United States about 20 times. Now, in order to do this much work, your heart needs energy, fuel, nutrition, supplied to it, just like any other muscle in the body gets its energy from the blood. Now, where does the blood come from that supplies the heart? It comes off of the aorta, which is the main blood vessel coming off of the heart. And right at the base of the aorta, there are some arteries that come off called the coronary arteries. They come down around the heart, on the surface of the heart, and surround it, supplying nutrition. Now, the fact that your stress test was positive may indicate that one or more of your coronary arteries is narrowed or plugged. Unfortunately, this is a common condition. It's caused by the gradual accumulation of fatty deposits in the inner layers of the coronary arteries. And it causes them to become smaller and smaller until they carry very little blood to the heart muscle. They may become actually completely plugged. Now, it's possible for a person to have narrowing of the coronary arteries wall and have no symptoms, to feel no pain, no shortness of breath, no difference in their exercise potential. Other people, however, will have pain, or they may have a sudden plugging or obstruction of a coronary artery, and this may give them a heart attack. About 1 million people each year suffer heart attacks because one or more coronary arteries are plugged. That's as many people as reside in Houston, Texas. And of those who have heart attacks, about a half of them, 500,000 people, die. That would be equal to the population of Denver, Colorado. So this makes coronary artery disease a disease that causes more people to die than any other disease in the United States. Perhaps you can understand why we're so concerned about this condition, and in your case, we're recommending that you have this heart cath tomorrow.
It's hard to understand that I could be in such serious condition and feel so good.
Well, how's a heart cath going to tell you if Walt's in any danger?
Now that's a good question. A heart cath will help us to actually see Walt's coronary arteries. And the cardiologist will have opportunity to project the film on a very special projector. He can actually see how the fluid runs through your coronary arteries. He can see if it runs smoothly and freely, or he can see if you have a narrowing of a certain coronary artery. If you have a narrowing, he can identify exactly where the narrowing is and the extent to which that coronary artery may be narrowed. So I think you can understand why it's important for you to have this test.
Yeah.
Now, if your coronary arteries are entirely open and the fluid flows freely through those coronary arteries, that's good news. You can go home. If, however, there's a narrowing at this particular point that can be identified, then we can take steps to remedy this before you have a heart attack.
Dr. Freeman, how did the test turn out?
The cardiologist and I studied your films very carefully, and I'm sorry to tell you that you have obstructions in your coronary arteries at several points, but we know exactly where those obstructions are, and we know the extent of them. Let me show you. This you'll recognize as the outline of a heart. Your right coronary artery is blocked about here, and we estimate that it's 90% obstructed. Your left coronary artery is blocked about here, and we estimate that it is blocked about 97%.
That doesn't sound too good. I suppose I'm lucky I haven't had a heart attack already. But is there any medicine that I could take to make the blocks go away?
Well, in this case, your entire heart muscle is threatened with poor circulation, and you might have a heart attack at any time. Now, if you just had a little bit of narrowing of one vessel or the other, there's a possibility we could give you medication over a period of time. But since you have such severe blockage, a surgical operation is indicated in your case.
Surgery? What kind of surgery? Dangerous surgery?
Well, Walt, in any operation, there's a certain amount of risk. But I can tell you right now that in your particular case, you're going to be better off with this operation than without the operation. Now, when it comes to answering your specific questions about this operation and requesting a full explanation of what's going to be done, I think we really should leave that up to the surgeon that you and I select together to discuss that with you. Now, the surgeon that I would like to recommend is an individual who has done many of these operations and has had good success. His name is Dr. Lewis. And if it's agreeable with you, I'll make the arrangements for him to see you as soon as possible.
You know, I never expected what you were going to tell me today, but thanks for helping me so far.
We hope everything goes very well for you, Walt.
Where's Mr. Sherman's chart?
Here it is.
Oh, thanks.
I was just in to see him, and he's very anxious to talk with you about the surgery.
Yes, I've been studying his heart cath, and it certainly looks like he needs surgery. I'm going down to his room now and talk with him about the operation. Thanks a lot. Mr. Sherman, I'm Dr. Lewis.
Nice to meet you.
Nice to meet you. Dr. Freeman asked me to study your heart cath and come by and talk with you about an operation. I understand that he explained the results of the test to you.
He showed me a diagram and explained where my arteries are blocked.
Good. Let's go over it again. You understand that your coronary arteries are severely blocked, up to 95%. We'd send you home now, Mr. Sherman. Your chances of dying of coronary heart disease would be 10% each year.
But I'm only 41.
Yes, it is a tragic disease, and it affects men and women who are even younger than you. Fortunately, we're now able to offer surgery, and with successful surgical treatment, your life expectancy can be better.
How much better?
There's evidence that your life expectancy can be that of the general population.
What kind of surgery and what do you do?
We remove a piece of vein from your leg and attach one end to the aorta and the other end to the artery below the obstruction.
You mean you actually bypass the block?
That's right, and that's why we call it a coronary bypass operation. The diseased artery is bypassed by the vein so that your heart muscle can receive all the blood supply it needs.
What you're saying seems to make sense. It looks like it might work quite well, but is it dangerous?
It does work very well indeed, and the risk is quite low, especially in your case since the heart muscle is still functioning very well. Your chance of not surviving this surgery is less than 1%.
That seems low for such a major surgery, but what about the 1%? What could go wrong?
As with any surgery, there are risks, such as infection, excessive bleeding, difficulty in healing the wound. Damage may occur in the kidneys, the lungs, the brain, even to the heart itself. But the possibilities of any of these complications happening to you are less than 1%. Nearly all of our patients go home within 2 weeks after the surgery.
Will I be able to get out of bed when I get home?
When you get home, you'll be able to get out of bed within a day of the surgery.
You're kidding.
No, I'm not. You'll be taken to an intensive care unit, and then the day after the surgery, you'll be up out of bed for a little while.
Now that doesn't sound too bad. How long will I be there?
You'll be there for 3 or 4 days, depending on how you feel. Later on this afternoon, a surgery nurse will be by to answer questions that you might have and to explain to you some of the special equipment that we use to monitor your recovery process. She'll also explain to you some of the special procedures that we use, and they'll be starting about a day or two before your surgery.
Where will I go when I get out of intensive care?
You'll come back to this floor, to a room very much like this one, and you'll then be in an exercise program.
Exercise program? That soon?
Yes, to keep you from getting stiff and to help to stimulate the circulation. You'll also learn about a diet and exercise program that you should continue after you've gone home.
Well, That doesn't seem nearly as bad as I thought it would be. When should I have the surgery?
The sooner the better. I'll schedule your case with surgery. There'll be a few days wait. And then I'll contact you and notify you when.
Even after the surgeon came in and explained to me the operation, it really didn't sink in until the surgery nurse came by and explained to me what was going to take place before, during, and after my surgery.
I've come by to talk with you both about your surgery and to answer any questions that you might have. Now, has anyone been in to shave you yet?
Yes, they shaved all the hair off, and I feel a little bit funny.
Now, have you been showering twice a day with the antibacterial soap that they gave you?
Twice a day, and I feel like Mr. Clean.
Okay. Your surgery is scheduled for tomorrow morning, right?
Right.
Well, the doctor said it'd be the first one in the morning, but he didn't say what time.
Okay. The first surgery starts at 7:45. Now, that means actually you'll leave the room to go down to surgery at 7 o'clock. Tonight after visiting hours, Walt, you'll be given a small cleansing enema. That's so you won't have to use the bedpan right after surgery. When your bowels are ready to move again, your nurse will be able to help you up to the bathroom. Now, it's important that you not eat or drink anything after midnight tonight.
Okay.
All right? That's going to be no breakfast.
No breakfast?
No. Your nurse will be in to wake you up at 5 o'clock. That's so you can bathe and dress before surgery. Now, at 6 o'clock, your nurse is going to come in with your pre-medication that your anesthesiologist will order for you today. Mrs. Sherman, if you wanted to be with your husband before surgery, you should plan to arrive at that time.
Well, I hope she would come in early.
Okay. That way, you'll have about an hour then before the orderly comes to take your husband down to surgery. When you get into surgery, EKG pads will be placed on your shoulders and the left side of your chest. Now, this is so we can watch your heartbeat on a monitor during surgery. We also want to monitor your blood pressure during surgery, but it would be impossible to get a constant reading using the standard blood pressure cuff. So what we do is insert a small tube in the radial artery of your wrist. Now, we'll numb it first so you won't feel it. This is the same artery we use when we're taking your pulse. This will give us a constant reading of the pressure in your arteries. Now, we also want to monitor the pressure in your veins, and the way that we do this is by inserting another small tube in a vein just under your collarbone. A little higher. Yeah, right about there. That's right. Both of these numbers will show up on a screen that your surgeon can see all during your operation. Next, the anesthesiologist will put a blood pressure cuff on your right arm and start an IV. Then he'll give you the anesthetic through the IV, and you'll be sound asleep. After your operation, you'll be taken to the recovery room, and the surgeon will be in to check on you and see how you're doing. Then he'll go out and talk with your family. When you wake up, you'll notice several tubes coming from the base of your incision. Now, these are attached to some drainage bottles at the side of your bed. These tubes allow the fluid that normally collects under your incision to be drained into the bottles. Now, they'll be in for several days. You'll notice, too, when you first wake up, you may not be able to talk. The reason for this is the anesthesiologist has put a small tube in your mouth and throat during surgery. It's attached to a machine that helps you breathe. As soon as you're breathing normally, they take that out, and of course you can talk right away again. Something else you may not notice right away is a urinary catheter in your bladder. During surgery, we can tell how well your blood is circulating by the amount of urine your kidneys are making. After surgery, we do special tests on your urine every hour for 2 days. Now, with the catheter, we can get those samples directly from the tubing and not disturb your sleep. The leg that we'll be taking the vein from will also be wrapped with an elastic bandage to help circulation. Do you have any questions?
No, I think I understand.
Okay.
Well, when will I be able to see him?
Well, you'll be able to see him when he's taken back to his room. That's in the CTCU area. Let's go up there and take a look so you'll know where he's going.
Okay.
This is the CTCU waiting area. When you come to visit your husband, come to this room. You can use this phone to call the nurse. Just press this button marked CTCU. Hi, Sharon, this is Janice. Mr. and Mrs. Sherman are with me. Mr. Sherman's going to be having his surgery tomorrow, and I'd like to show them the unit. Okay, fine. Thank you. We can go in now. Hi, Sharon. This is Mr. and Mrs. Walt Sherman. Walt, Sharon will be one of your nurses when you come out of surgery.
Good.
Welcome to the cardiothoracic care unit.
What does cardiothoracic mean?
It's just a fancy way of saying heart-lung unit. We call it CTCU for short. You'll be coming here after you leave the recovery room, and we'll be monitoring your blood pressure and your heart rate and your heart functions on these monitors here. And then we'll be informing your doctor of your progress.
Did all these patients have coronary bypass surgery?
No, some had other types of surgery, but most of them have had either heart surgery or lung surgery. Mrs. Williams had bypass surgery yesterday. Would you like to see her?
Okay.
Mrs. Williams?
Yes.
Janice is here to see you.
Oh, hi.
How are you feeling?
Well, I'm feeling better than I thought I was going to feel.
That's good. I'd like to have you meet Mr. and Mrs. Sherman. Walt here is going to have his surgery tomorrow.
Oh, hello.
Hi.
Are you comfortable? Are you having much pain?
Just a soreness, mainly when I cough.
Are you holding the pillow across your chest like we showed you? Real
Yes. Yes, I am.
tight? Okay, that's good. Now, Walt, you remember that I told you how we monitor your blood pressure and your heart rate. These leads here go to the machine, and then we can see her heart rate right here and also out at the desk. And then this set hooks in here, and we can tell what her blood pressure is here and also out at the desk. Have you been doing your exercises?
Yes, I'm getting quite good at them.
That's good. We're going to be going back to Mr. Sherman's room now, and I'll be showing him the exercises that we're talking about. Thanks a lot for letting us stop by, and I'm glad you're doing so well.
And good luck to you tomorrow.
Thanks.
These patients all had surgery a few days ago. They're in a special program of exercises for rehabilitation. You will learn how to improve your circulation so that you'll be able to do as much, if not more, than you do now. Right now, I want to show you the exercises that we'll have you do right after surgery. These exercises are the most important thing you can do to aid in your recovery. The first one I want to show you is deep breathing. Now, after surgery, your chest is going to feel very sore, and you'll be tempted to take just little shallow breaths, but you mustn't do that. We want you to take very deep breaths to get the air way deep down in your lungs. This will help to keep them clear. Now, take your hand and put it on your stomach. That's right. Take a deep breath in through your nose and hold it. Okay, now let it all out through your mouth. That's right. Did you feel your hand coming out when you inhaled and then go back when you exhaled?
Yes.
Coughing is also very important. It helps to bring up the mucus that forms in your lungs after surgery. Now put your hand back on your stomach again. Take a real deep breath in. Now cough. After surgery, you'll be given a small pillow to hold against your chest to support those sore muscles. An inhalation therapist will be in later to give you a breathing treatment called IPPB to help you become familiar with it. Now, you'll be given these treatments every 4 hours after surgery. The reason that we have you do these exercises and have these treatments is to prevent your lungs from getting congested, which could lead to complications. The last exercises that I want you to practice are the leg exercises. Now, flex and extend your foot 3 times. That's it. Now, rotate your ankle clockwise and counterclockwise. Now, flex and extend your whole leg 3 times. That's good. After surgery, you'll be doing these exercises with both legs to help your circulation and prevent blood clots from forming. You should practice these exercises several times today so that they'll come easy for you after surgery. Now, are there any questions that I haven't answered?
No, I think you've covered everything.
Mrs. Sherman, this is as far as you'll be able to go. The surgery waiting room is down the hall, and the doctor will be out to see you after the surgery is over. Goodbye, honey.
Well, the surgery was a success. I was in CTCU for a few days and then went into a regular room where I entered a program of rehabilitation, exercise, and diet. And in about a week, I was ready to go home.
Good morning, Walt.
Morning.
You look great.
Well, I feel a lot better, and I'm ready to go home.
Well, that's fine. Now, when you get home, I hope you will remember to follow all the instructions on how to keep your heart healthy. And Mrs. Sherman, can you help him follow his diet? And remember to take his exercises and his medication?
I'll try, Doctor.
That's good. Now, we'd like to see you in the office in about a week. In the meantime, go home and enjoy life, enjoy the family, and don't worry about the big mountain of work that's accumulated. That can come later.
Mr. Sherman,
Yes.
I'm ready to take you to your car.
Well, good, but I think I can walk down to the car myself.
I think we better take you out. We're supposed to take you.
Okay.
Well, one other thing. We'll have the office call you and give you a specific appointment.
Okay. And thanks a lot, Doc. Goodbye.
Goodbye.
Bye, Mr. Sherman.
You may not be as active after your surgery as I have been, but if you do what your doctor says, keep up your exercises and eat right, you will feel better as you get back in the swing of things.